Hi, sir. So sorry for being cut off. I actually was not expecting it to do that because it worked yesterday without issues, but so I guess we can continue, sir. Thank you, sir.
Yeah. Can you give me the so I can share my screen? Can you see the screen now?
Yes, sir. Yes.
Great. So I think this is where I was trying to explain the history of antibiotic resistance. So over the years, as the antibiotics were being discovered, as bacteria were becoming resistant to antibiotics, more were being discovered, and they were trying to survive. It's like there are bottlenecks. The bacteria will find a way to go around and survive. Do you understand? So in around 1953, antibiotics were introduced to animal feed in Europe. So after then, there was serious problem with antimicrobial resistance. When they give antibiotics as feed promoters, they use them to raise more raise their animals. Do you understand? So believing that it will aid productivity. So around 1987, daptomycin was invented. That's another class of antibiotics. But around 1960, we had the first strain of MRSA. You understand? Initially, we were having Staph aureus being resistant to penicillin. You understand? But after, in 1960, in fact, it was discovered in a UK hospital. 1960, MRSA was discovered. And what happened was with Staph aureus, that is MRSA, is that once it is resistant to methicillin, it will be resistant to all beta-lactam antibiotics, all of them. You understand? And today they are becoming resistant to even carbapenems and other classes of antibiotics. So it was a big problem. So after 1960, that was when the world, started noticing that if they don't work hard to control antimicrobial resistance, it will be devastating on the world. In fact, in 2014, the British public vote for antibiotic resistance to be the focus of the 10 million longitude prize. In fact, that longitude prize is that when they noticed that all antibiotics were not working again, they understand. They now find out that one of the ways they can solve this problem is to even discover more antibiotics. But people were not, novel works are not coming to discover antibiotics. So they brought out a prize. Even up to date, no new antibiotics have been discovered by scientists. And in 2015, the World Health Organization rose to action, started, raising awareness concerning antimicrobial resistance. In fact, you guys, I don't know if you are celebrating the Antimicrobial Awareness Week. Then in 2015, it was initially tagged Antibiotics Awareness Week, but now it has metamorphosed into Antimicrobial Resistance Week. So in 2017, scientists produced improved form of, people are trying to work on the antibiotics that are existing, but new ones are not being developed. So the present day, individuals, researchers, and policymakers are all working together to fight AMR. I think that is what IBSA2 is doing in its own capacity. Now, development of AMR. Development of antimicrobial resistance is a natural phenomenon. Do you understand? It is a natural thing because once you use antibiotics, the bacteria, one way or the other, will find a way to evade it. You understand? Every time antibiotics are used, bacteria are offered the opportunity to develop resistance. If they are not exposed to the antibiotics, they won't know how to evade it. You understand? But once you use an antibiotic, you'll find a way to evade it. So resistant bacteria can be transmitted between animals, humans, and the environment. In fact, AMR is a problem for both animals and, more importantly, humans, because we are more at the receiving end. You can see the bugs are not, in fact, probably they're even hitting the antibiotics and becoming super bugs. Do you get it? So, and you can see in the how is AMR occurring at the farm level, in the environment, among humans? It's like a cycle. You understand? When farm animals, when they receive antibiotics, but these bacteria will develop resistance. These animals, they pass out excreta, their urine, their manure. Animals will come in contact with these animals, so it continues to spread. Even it gets to the plants that we food crops. You'll be surprised that antimicrobial resistance genes are found in crops. You understand? They are found in crops today. So it goes around that we humans will eat this food, we eat these crops, and we are eating part of this resistant bacteria into our system. So it is a cycle. Do you understand? It is not just a one-way thing. If it happens somewhere, it will go around and it will affect everybody. So what are the factors that increase the development and spread of AMR? The problem at present is that the continued use, particularly the inappropriate use of antibiotics in humans, animals, and in other situations, is leading to significant increase in the development and spread of AMR. But the major issue that is being noticed, that as the drivers, we call them drivers, that drive development of drug-resistant pathogens, are what? Misuse and overuse of antimicrobials. Misuse and overuse of antimicrobials. More specifically, when antibiotics are being overused, when there is underdosing, you understand, with antibiotics, not finishing a treatment course will lead to antimicrobial resistance, incorrect disposal of antibiotics, incorrect disposal of antibiotics. So I'm repeating that. Use of high-spec, broad-spectrum antibiotic, when in narrow spectrum, more basic antibiotic will suffice. Instead of you killing a small stick with a small stick, you went all the way to go and bring, a bazooka or an AK-47 to kill something that is small. You get it. You will create more problem in that process. Blanket use of antibiotics in an untargeted manner. Treatment of bacteria that are not susceptible to the particular antibiotic. No, that is can I call that mistreatment? Treatment of bacteria that are not susceptible to a particular antibiotic. I'm repeating that. The treatment of diseases caused by viruses or other germs not susceptible to antibiotics. You'll be surprised that for a viral infection, people are using antibiotics. It won't work. So with all this, with these drivers in place and all that, microbes have gone crazy. Do you agree with me? They have gone crazy, and antibiotics are what? They are on the run. Look at this. This is an antimicrobial susceptibility testing using disc diffusion. In 1991, this is a particular bacteria was very susceptible to a lot of antibiotics, but current year, 2021, look at what we have, probably susceptible to maybe just 2 of about 15 antimicrobial agents. So these bacteria, these microbes, they have what? They have gone crazy. While antibiotics are what? Are on the run. In fact, the antibiotics are, they are picking rays, if I may use that word. You get it, and they are even, overcoming antibiotics. So this is a big problem. As I've said, this is a big problem. We all must come to the challenge to solve this problem. So as a vet, because I'm talking to IVS members, and I know one day you all will become vets. So as a vet, how do you contribute to AMR control? You understand? So when it comes to animal health, prevention is better than cure. We all know that. And the first step farmers can take to prevent the development of AMR is to improve the overall health status of the animals on the farm. You understand? It's not about when there is a problem, it's not about just rushing to give antibiotics, just rushing to treat. There are some problems that will occur in the farm will not necessarily mean that you use antibiotics. Probably monumental biosecurity will solve those things. So prevention is better than cure. This will not only reduce antibiotic use on the farm, but it will also maximize farm productivity. And this can be achieved through disease prevention strategies such as good biosecurity measures, adequate housing, optimal stocking density, vaccination, very effective, and parasite control. Under no circumstances should antibiotics be used to compensate for poor farm management practices. And that is what most farmers do today. When you get to their farms, the farm environment is not looking good, is not okay. They are not implementing good biosecurity. But when there is a disease, instead of them to take care of all those normal things, monumental things, you now rush to antimicrobial agents, and that will not do well. So prudent use of antibiotics. Antibiotics should be used to maintain animal health and welfare when necessary. And when you want to use to maintain animal health and welfare, the meaning is that you should use antibiotics prudently. And there are 6 R's that should be followed when using antibiotics. The first one is that you use the right veterinary diagnosis. You have to diagnose before you treat. You get it? If you don't diagnose, what are you treating? What do you know that you are treating? So you have to first get the diagnosis correctly. Then you treat the right animal. If animal A is sick and you are treating animal B, the disease will not go. You get it? You use the right antibiotic. You use the right dose, the right duration, right storage, and duration. So all these are important, and these are the components of what prudent antibiotic use. But on a more larger scale, across the world, there is need for coordinated action. This is according to the WHO, because AMR is a complex problem that requires a united multisectoral approach. In fact, the One Health approach brings together multiple sectors and stakeholders engaged in animal, terrestrial, aquatic, animal, and plant health, food and feed production, and the environment to communicate and work together in the design and implementation of programs, policies, legislation, and research to attain better public health outcomes. So the main solution to this issue is what? One Health, the One Health approach. Doctors in the hospital cannot work in isolation. Vets cannot work in isolation. We all must come together, even environmentalists, to nip the problem in the bud. So there are efforts all around the world. There are efforts all around the world to control antimicrobial resistance. And the first one of the most important ones that we have recognized today, developed by the WHO, the FAO, the OIE, the tripartite organization, World Leading Organization on Human and Animal Health. It's called the Global Action Plan on Antimicrobial Resistance, the GAP. So around 2015, the World Health Assembly, they felt that the world should come together and develop each countries all around the world should develop a national action plan on antimicrobial resistance, how to control the control of antimicrobial resistance. And since then, it was endorsed by the Food, FAO, by the OIE. You understand? They encourage every country that signed the treaty that they should develop a national action plan to control AMR. And in fact, in Nigeria, we have ours. Ours is called what? The National Action Plan for Antimicrobial Resistance Control. It's expected to last for between 2017 and 2022. Now, after the meeting of 2015, some countries started theirs around 2016, but we, Nigerian factor, we were slowed a bit and we started 2017. It will end next year. So if it ends next year, what's the next thing? What is the content of this National Antimicrobial resistance plan. It contains several information. It talks about, it has a background, the AMR situation in Nigeria, the situation of AMR in Nigeria. Actually, the document was developed by the Federal Ministry of Agri, Environment, and Health. So they talked about AMR situation in Nigeria, in the hospitals, in the environment. But when I went through the document, I noticed it has some gaps. The animal health sector was poorly, documented. The situation analysis about the animal health sector was poorly documented. And in fact, I met some of the guys from NCDC in the conference I attended in Sydney, Australia, and I told them this fact that this document is comprehensive enough, and it is lacking in the aspect of animal health, which they agreed to me. But this document contains some strategic plans. Number one is that one of the focus areas is that increasing awareness and knowledge of AMR and related topics. I think this talk is one of the awareness. We have to talk to people. We have to make people aware that the issue of antimicrobial resistance is a big problem. Students, workers, parents at home, everybody in the society must be aware of what the problem of AMR is. Do you understand? Then it also focuses on building a One Health AMR surveillance system. I think Nigeria is working on this. Today we see, if you look at I don't know if you guys know about the MFLT program. It comprises medical doctors, vets, laboratory technologies coming together to run a public health program, research and all that. So all in a bid to control AMR. So it talks about intensifying infection prevention and control in the tripartite sectors, promoting rational access to antibiotics and antimicrobial stewardship, and investing in AMR research and development, because we cannot develop without research. And if we don't invest in AMR research, I don't know how we can solve this problem. So other efforts that have been identified include a tripartite joint secretariat on AMR by WHO, by FAO, by OIE. They have a joint secretariat where they talk about AMR always. The World Antimicrobial Awareness Week, WA, previously the World Antibiotic Week, and since 2020, it has become the World Antimicrobial Resistance Week, and every organization making efforts during this week to sensitize people, to enlighten people about what AMR is all about. Then we have the Global Antimicrobial Resistance and Use Surveillance System. This system, a lot of surveillance is being conducted to fill knowledge gaps and to inform strategies at all levels. Then we have the global research and development priority setting for AMR. You get it. So there is a research guide into how new antimicrobial diagnosis and vaccine can be developed to combat very terrible pathogens. Do you understand? In fact, the WHO has documented a list of priority pathogens. Here is the list. Priority pathogens that should generate interest from researchers. You understand? In fact, some are called priority 1 critical, as Acinetobacter baumannii campina resistance, Pseudomonas aeruginosa, Enterobacteriaceae, ESBL producing organisms. They are called the priority 1 critical, priority 2 critical, Enterococcus faecum, the vancomycin resistant one, Staph MRSA, very notorious. And today we're having vancomycin immediate resistant MRSA, Helicobacter pylori, and Campylobacter salmonella, and all that. So the priority 3 medium, then we have these other ones too. So these are important bacteria resistant, bacterial organisms that become resistant to a lot of drugs, and that requires that we conduct a lot of research on them. And lastly, we have the Global Antibiotic Research and Development Partnership Program. You get it? So here, a joint initiative of the WHO and the Drugs for Neglected Disease Initiative. They conduct research through public-private partnership into neglected diseases in a bid to combat AMR. So while over the years too, in Nigeria, I told you earlier that the National Action Plan for Antimicrobial Resistance is deficient in a way in terms of the situation analysis, that we have a few information about the animal sector. So this prompted us, some of us in Nigeria, to look at the situation analysis about AMR in food animals and in the environment. But this work is generating a lot of citations today. Do you get it? So we filled that gap, and today people, you can go online, read this paper, this article. You'll get to know the pathogens that people have worked on, the antimicrobials that are becoming resistant in the country in terms of food animals and the environment. Also, we have conducted some research, even on students, veterinary students, their antibiotics use, their practices, their knowledge of AMR. And in fact, in this study, we found out even veterinary students have, their knowledge about AMR is very low, less than 60%. But with this program like this, I think you guys will, you are coming up and the percentage will increase. The problem is actually serious in Nigeria. You get it? We found out that the way people use antimicrobials in dairy cows, in small animals, in small ruminants is alarming. And when we compared what we have about the knowledge level in veterinary students in Nigeria, South Africa, Sudan, found out some other countries are even doing better. So, but with our intervention, I think the awareness level is increasing. So we have done some research. In fact, as I've said, I worked on MRSA, and we found out that there are some new strains of MRSA. Imagine new strains of this bacteria. Imagine new strains every day, and they are even being transmitted from animals to humans. So that's a big problem, and that is a challenge to all of us, that we must work hard to control this problem. And as I've said, the One Health approach is highly important, the human animal environment, for us to control this program. And the main goal is to enhance cooperation and expand interdisciplinary collaborations between all fields to promote health and well-being. So, and what are the things that we do? We have to improve communication. This is one of the ways one of the things we do. A lot of talks. I belong to the early career researchers on AMR. We do some of the programs you guys do. We do such to increase awareness about AMR, to do research together on AMR, and to combat AMR together. So it should be a multidisciplinary collaboration and cooperation with important roles to play at the intersection of human, animal, and environmental health. Then national and global commitment and support is also very important. So just as I've said earlier, the WHO, the FAO, the OI, they are speaking to one voice, all to control AMR, and their aim is to ensure that antimicrobial agents continue to be effective and useful for curing diseases in animals and humans, to promote prudent and responsible use of antimicrobial agents, and to ensure global access to medicine of good quality. Nigeria, you all know what happened out there. There are so many fake drugs out there, and we know the consequences of this. People will use drugs. This lady, this professor that headed NAFDAC, one of the reasons why she was very, very, very ferocious when she was in NAFDAC was that she said she knew somebody very close to her that died because they were giving her fake drugs. You understand? So there's so many fake drugs in Nigeria. So the FAO has its global action plan against AMR2, the Nigeria plan against AMR, all in the bid is to what? To improve awareness and advocacy on the AMR-related threats, to develop capacity for surveillance and monitoring of AMR and antimicrobial use in food and agriculture, to strengthen governance related to antimicrobial use in food and agriculture, to promote good practices in food and agriculture and prudent use of antimicrobial resist antimicrobials. So this is a duty for every one of us. This is a duty for every one of us, and we must be on ground to be committed in doing this. So I want to say thank you all for listening. Thank you. Let me stop here, and we'll be expecting your questions. Thank you. The moderator?
Oh, sorry, sad. Let's see. Very good. So sorry, the light went off here. So thank you very much, sir, for a very wonderful presentation. I'm sure everyone that is here today has learned one or two things about antimicrobial resistance. And with this knowledge, hopefully they can have interest in research related to antimicrobial resistance, get encouraged to continue to spread the word about antimicrobial resistance, creating awareness, posting on their social media pages and handles, and also be interested in learning more about antimicrobial resistance. We will take questions shortly. So if you have any questions, you can either type it in the chat box or raise your hand or mute yourself and speak. Thank you very much. Hawaz, do you have a question for us? While we await questions, I would like to ask that okay. So what is like the simplest way that we students can contribute in preventing antimicrobial resistance? Or like if let's say we want to start small, like it's not everyone that can gather everyone together to kind of like host a webinar or something. So what is like the simplest thing that we as veterinary students can do to just improve the situation of antimicrobial resistance in the country? Thank you, sir.
Yeah,
okay.
Thank you for
Good evening.
question. Okay. Can you hear me?
Yes, sir.
Okay. Yeah. There is no effort is more. Let me put it that way. No effort is more. You just start from your immediate environment. For instance, you are in 600 level. Talk to your colleagues about AMR. Be an advocate of this campaign. Talk to your colleagues. You start from there. It's not about you having a lot of money before you can contribute to the antimicrobial. You have a family. Do such in your family to talk to them about prudent use of antibiotics. In those days while I was young, there's this drug that my people will ask me, I was young, they will ask me to go and buy. They said they call it mix here. A lot of drugs they will mix together, probably 10 naira or 20 naira there. You just, at night they'll just use everything. So people use drugs anyhow. So you start talking to them, you understand, on how to use these drugs very well. So you start from your colleagues, talk to them, you are aware about this, you make other people aware. As little as that, you get it. So I think that will be fine.
Thank you very much, sir. Gaius, Gaius. Yes, you can unmute yourself and ask your question.
Okay, thank you so much, sir. All right, thank you so much, sir. The lecture was really enlightening.
Yeah, thank you. I'm listening.
I think he's maybe having some network issues. Gaius, we can't hear you anymore. In the meantime, we have one question in the chat box. Shagaya Abdulkabir says, has there been any government policy in Nigeria regarding antimicrobial resistance?
Yeah, certainly. Just like the one I showed, the National Action Plan on AMR is actually a policy document that is expected to run between 2017 and 2022. So there is a policy, and I want to believe that by 2022 it will be reviewed and probably extended to cover some of the shortcomings they might have noticed. The NCDC are actually in charge of ensuring compliance with the policy. You understand? So there's a policy on AMR, though might not be comprehensive enough, might not cover these medical guys probably have hijacked a major part of it, but maybe they are doing well today to get vets involved. Do you understand? Apart from that, we have international policies, international influences. For instance, the Fleming Fund is a grant that's focused on AMR. They appointed a lot of fellows in the country to do research on AMR to improve, knowledge about AMR, fill some gaps. Do you get it? And one of such is the lab that we have at the VTH. It's being funded by Fleming Antimicrobial Grants. You get it? So there are a lot of grants on AMR out there, and they are useful for us. Thank you. I hope that answers that.
Thank you, sir. We have another question that says, has there been any campaign on antimicrobial resistance in Ilorin metropolis? And what are the steps that can be put in place to change the minds of people on antimicrobial resistance?
Well, as far as campaign on antimicrobial resistance in Ilorin, well, I cannot say for sure, but I'm sure one way or the other, some people who are out there to encourage people on prudent, at least on prudent antibiotic use. Do you get it? So, and when you say Ilorin metropolis, I'm not so certain about that. Do you get it? But to change mind of people is just an advocacy thing. You understand? It's just an advocacy thing. There are so many ways you can do that. This webinar is one of such. You have you produce placards, stickers, you talk to people. Do you get that? Simple things that you can do to change people's mind. Anything you can do to change people's mind by talking, by a lot of things you can do. Simple things. So it's easy.
Okay, so Gaio says his network is poor, but he says, my question was, how can improper disposal of antimicrobials lead to AMR?
Just let me give you a simple example. As a vet, you go to a farm to treat animals, and you did not probably dispose the remnants of the drug that you have used on your animals. You'll be surprised that these Fulani people or the farmer who does get hold of such a drug, if they still remain, can use it or can just look for the label, go to the market, buy it and use it. There are so many drugs that are being sold over the counter. So if we are not being diligent as professionals, if we are not doing the right thing, a lot of wrongs will occur. You get it? So it's very easy. Thank you.
Thank you, sir.
Yeah.
Is there someone else? Ade Yusuf Rodia asked, is there incorporation of antimicrobial resistance in the curriculum of veterinary medicine in Unilorin? I think so.
Capital, no. But personally, as lecturers, we talk about this. Do you get it? But it is not in black and white in the curriculum. Maybe when we review the curriculum, we can include that, but it's not. But we talk about this, and some of you know. Thank you.
Thank you, sir.
Yeah.
Okay, any other question? Okay. Guys, we're still waiting for your question. So is it possible that if, let's say, all these control measures, preventive measures are kind of like put in place, is it possible that the bacteria that are already like maybe resistant to these antibiotics can become non-resistant, or like, okay, yes, we are putting these measures in place, but the bacteria are already on ground and causing a lot of havoc. What can be
Yeah.
done again? I don't know if that makes
What
any
can be
sense.
done?
Yes.
Yeah, when once a bacteria is resistant to a particular antibiotic, so I don't think there is a way back. So the solution is not that particular antibiotic again, you know, because they were becoming resistant to such to a particular antibiotic. So people were making an effort to discover new ones. So after some time, they evade such too. So I don't think the solution would be to with the antibiotics. There are other means to control infections. There are other means to control infections. Apart from good management system, biosecurity, and that, you can. The people are talking about phages too, but phages, bacterial phages today. They're talking about probiotics. They understand? Very useful vaccines. We are talking about developing vaccines. Malaria, for instance. We have used drug a lot. So it's not changing things. But also, we are looking forward to vaccines. So I think other means should be used rather than drugs. Thank you.
Thank you very much, sir. So if we don't have any more questions, I would like to draw the curtain here. And if you have any other question, you can feel free to message me on WhatsApp, and I will try to forward the questions to our honorable guest speaker, and hopefully you'll get a reply soon. Thank you so much, sir, for joining us. We are very grateful,
Yeah,
and we
thank
thank
you.
you for a very enlightening session we had with you. To our members, I want to encourage us all to join in next week on the 18th by 10 a.m. for our last session, which will be having two very, very interesting speakers. One will be talking about mental health, and the other one will be talking about making your application stand out as whenever you are applying for any position. I would also like to mention that the person that will be coming to talk about making your application stand out is a Commonwealth scholarship winner. And I feel like you have a lot to gain from someone like that. And you can always ask questions about applying, writing a CV, motivational letter, personal statement, as well as any other questions you may have. So thank you everyone for joining in. And okay, we have 1 minute, so I'll just drop the attendance link for you guys to fill once again. And I would like to announce the winner of our award Rabies Day competition. I don't know if this time would permit because I have less than 1 minute. But briefly, our winners I hope we can see my screen. We have Adeleke Mr. Olalekon, who won the World Rabies Day competition, and we will be awarding him 5,000 naira gift prize. And we also have Oluwagbemiga Ojo Baro for also winning this competition for winning the runner-up as well. I would also like to announce another competition that will be taking place throughout the whole term. And this is basically the person that is the most active member of Ivsa Unilorin. Basically, for you to participate in this contest, you have to be an Ivsa Unilorin member, and you also have to try to attend as many of our events, competition, whatever we are doing, you have to participate.